Finally, the long-awaited day has come. Today, we are beginning our virtual 11th Annual National Research Ethics Conference here in Kampala at Next Media Conference Center. Honorable Minister of Science, Technology, and Innovations, distinguished guests, participants who are joining in online, those who are joining in at home, those who are here physically. Ladies and gentlemen, good morning. On behalf of the annual National Research Ethics Conference Planning Committee, it is my pleasure to welcome you to the virtual 11th ANREC organized by the Uganda National Council for Science and Technology and partners. This year's ANREC focuses on fostering research integrity and responsible conduct of research in Uganda and the region. Ladies and gentlemen, wherever you are joining in, you made the right decision to be a part of this year's ANREC. This ANREC is very special in several aspects. The mere fact that it is virtual, it provides opportunity for many of us, many of you, wherever you are, to be a part of this ANREC. The timing to have a national and regional discourse aiming at promoting excellence, compliance, and good research practice is now. I cannot think of any other better time than today and the coming 2 days for us to deliberate on issues that regard research integrity and responsible conduct of research in the nation, but also in the region. The increase in research being conducted in the country and the resultant complexity of research questions, the need to look for solutions and technologies or innovations to address the problems that come with population growth, climate change, increase in emerging and reemerging diseases, as well as non-communicable diseases such as diabetes and cancer, are all contributing to competitive research environment, which threatens research integrity and ethical research practices. When there is increase in research, as it is in Uganda and also globally, it means that we are all competing for the same funds. And with that competition, there comes the competition in the research environment. COVID-19 pandemic has not spared the research enterprise. From disrupting research activities to publishing questionable research findings, the rush to use unproven products as remedies, we find ourselves in a scenario that calls for establishment of specific policies and guidelines to foster research ethics. Ladies and gentlemen, whether one is a researcher or a member of the public, research integrity affects all. May I ask a question as we begin our 11th ANREC? Why should the public continue to trust researchers and research outcomes? Why should fellow researchers have confidence in your research findings? How do we ensure that we remain objective and honest at all stages of research, from inception of the idea or research question through the implementation of the research, right up to dissemination of findings? The 11th ANREC provides us a platform for training, sharing of experiences, and feedback from research institutions, academia, and the community on ethical issues related to research management, conduct, and other practices after research implementation, such as dissemination of research findings. Ladies and gentlemen, a quick glance through the list of presentations and activities planned for the 3 days of the conference reveal the breadth of areas that need collective effort and commitment to uphold the highest ethical standards in research. Our program for these 3 days of ANREC range from our experiences, 10 years experiences and lesson learned to change. They range to the changes in the common rule and how they impact research in Uganda and the region. There's increase in genetics and genomic studies, not only in Uganda, but also everywhere on the African continent. In this UNREC, we shall have a discussion on policies and regulatory frameworks by representatives of research regulatory bodies within the East African region. As the advisory and planning committee of the 11th UNREC, we provide you with a rich menu for the next 3 days to provoke discussion on all these issues. We are privileged to host highly respected international and local speakers who will share, discuss, and analyze current and new practices that promote research integrity and responsible conduct of research. Ladies and gentlemen, we now know from research conducted elsewhere from the African continent, specifically from West Africa, that communities are no longer passive recipients of research products. We still have more to do in regard to community engagement and inclusiveness. UNCST, together with its partners, the National Drug Authority, Uganda National Health Research Organization, Uganda Wildlife Authority, biosafety committees, institution research ethics committees, are at the forefront of guiding policy and frameworks to ensure that communities are protected from unnecessary harm and that they share the benefits that accrue from the research they participate in. At this UNREC, we will also officially launch the National Research Biobanking Guidelines and the National Guidelines for Use of Animals in Research and Teaching. Once again, ladies and gentlemen, wherever you are joining in, I welcome you to this virtual 11th UNREC, and I wish you fruitful deliberations. Thank you very much. And it is now my honor and privilege as the chairperson of the Advisory and Planning Committee of the 11th UNREC to invite the Secretary to the authority, National Drug Authority, to come and address all participants. Thank you very much. Dr. Helen, you are welcome.
Honorable Minister of Science and Technology and Innovation, Honorable Dr. Monica Msenero, the Executive Secretary to the Uganda National Council for Science and Technology, the Director General of UNRO, Dr. Sam Okware, the Chairperson Advisory and Planning Committee of the 11th UNREC, Dr. Gertrude Chiwanuka, and the chairpersons, the forum for research ethics committees in Uganda and members of the research ethics committees, management and staff of the National Council for Science and Technology, distinguished researchers, contract research organizations, ladies and gentlemen, all present here and all those listening in online. A very good morning. I have the honor and privilege on behalf of the Secretary to the Authority, National Drug Authority, to participate in this important meeting. The Secretary to the Authority was not able to come in person because of some other commitments. As National Drug Authority, we are pleased to have partnered with Uganda National Science and Technology Operation since 2001. Have been part of the annual planning committee, and particularly this year where we plan to discuss key issues related to regulation of research in line with the theme of the conference, which is fostering research integrity and responsible conduct of research in Uganda and the region. We are really delighted. The mission of National Drug Authority is to promote and protect public health through the effective regulation of human and animal medicines and healthcare products. According to the National Drug Policy and Authority Act, and of the Chapter 2000 of the Uganda laws, it is our responsibility to ensure the availability at all times of essential, efficacious, and cost-effective drugs to the entire population of Uganda as a means of providing satisfactory health care and safeguarding the appropriate use of drugs. New and emerging and re-emerging infectious diseases have threatened mankind for decades, and the current COVID-19 has highlighted new areas of improvement of research regulation to make available systems responsive to the needs of the community in the face of an ongoing pandemic. Indeed, in many aspects, be the same. And it has now been 17 months since the concepts of national lockdowns have been mandated by the government to reduce the rate of spread of the infection. So we have, in the meantime, as organizations, partnered National Drug Authority and Uganda National Council for Science and Technology. We have partnered in providing stewardship in the implementation of the SOPs, of the standard operating procedures within the clinical research environment and animal field trials on farms to prevent all health workers, veterinary professionals, farmers, and patients from the spread of the COVID-19. The two organizations have implemented a joint review mechanisms of COVID protocols that have reduced the timelines from many months to down to just 2 weeks. And so NDA has worked also with the Ministry of Science and Technology and also local manufacturers to increase local production as is part of our mandate of selected medicines under the Buy Uganda, Build Uganda policy. And as such, a number of local scientific innovations have come up, including herbal medicinal products for supportive treatment of COVID. And also the rush to use other unproven products has increased. So with the restrictions in movements and the number of challenges that are brought up by this, and make our priority, and the effects of the COVID-19 on the current drug regulatory landscape have highlighted the importance of dynamism and responsiveness of the regulatory systems to access of medicines, and yet we have been charged with retaining the integrity of the processes. And if there is anything that COVID-19 has taught us as medicine regulators, it is to look and to work in emergency mode to promote public health. Increasing numbers of medical products are evaluated in clinical trials and introduced in many African countries, including Uganda. There is a growing need to ensure that effective systems are in place to regulate these clinical studies and to monitor them for potential adverse events. And to date, these aspects systems have not received much attention that they merit, but the need, therefore, to foster responsible conduct of research in Uganda, reflected in our theme today, is highlighted. Similar challenges are faced by all countries, and there are opportunities for different countries to share experiences, learn from each other, and coordinate efforts to develop their national regulatory systems And ANREC has always provided that opportunity, and NDA is glad to be a part of that story. The National Drug Authority recognizes your efforts as National Council for Science and Technology, and also for the ministry. We recognize the efforts to meet the shared goal of promoting good practice in research and ensuring that the rights and safety and well-being of trial participants are protected and consistent with international declarations like the Declaration of Helsinki that Uganda has signed to, and that the clinical trial data is credible and that it can be used to inform product labels and changes in policies. So clinical trials provide a foundation for new drug development processes as well as for product licensing. And this is important for us in these low and middle income countries in sub-Saharan Africa. And therefore, medicine regulation as a whole has been stretched and challenged. And we have devised fast track processes for the COVID treatment, for the COVID related treatments. And we have also relied on mutual recognition uh, with the other regulatory authorities, and also use of the emergency listing by WHO. The NDA is cognizant of the role of research in finding treatment options and current burden of disease, and is determined to create a supportive environment for the conduct of clinical research, to create to promote the highest standard of regulatory oversight. And some of the key strategies that we use are collaborations with other regulatory agencies like Uganda National Council for Science and Technology and other national and regional partners. And we also work with experts, of which many are the researchers who are in the conference today. And we also do a lot of capacity building for our regulatory team, because it's the only medicine regulatory uh, place in this country. So we also benchmark with other regulators elsewhere. And the National Drug Authority today has the mandate to protect the rights of the participants, and we cannot achieve this really without stakeholders. As we reflect on the theme of the conference, we as researchers have to move towards self-regulation and adherence to all local and international regulations. So in closing, I would like to say that we are fortunate to have a vibrant research community and a conducive research environment, and that ensures the safety and health of Ugandans, and also to have dedicated individuals who have applying their talent and expertise to translating the research into policy. Of course, health is wealth, and where there is no vision, the people perish. Therefore, I would like to commend our leaders in the different technical institutions and in political leadership for supporting us in organizing such an important meeting, because Uganda must be a dynamic, healthy, developmental, creative place to live and work. As NDA, we remain committed to delivering our mandate to ensure that medicines and healthcare products are available to the Ugandan population, which are safe, efficacious, and of high quality. I wish you fruitful deliberations in this meeting for God and my country. Thank you.
Yes, thank you very much, Dr. Helen Ndagije, for representing the Secretary to the authority, NDA. Very reassuring to know that you are committed, and you are also committed to protecting Ugandans, especially those who participated research participants in clinical trials. And ladies and gentlemen, allow me to introduce the rest of the panelists. So on my immediate left, I have Dr. Martin Ongol, the Executive Secretary, UNCST. And then I have Dr. Sam Okware, the Director General, Uganda National Health Research Organization. And then in our midst, we also country director of the Center for Diseases, CDC. Center for Diseases Control. Center for Diseases Control. And this is Dr. Lisa. Yes, she will introduce herself later on. This juncture, I would like to invite the Director General, Ugandan National Health Research Organization, Dr. Okwari. Please come and address the 11th ANREC. Thank you.
The Honorable Minister of Science, Technology and Innovation, and also the Senior Presidential Advisor on Epidemics, of the Advisory Committee, the Chair of the Research Ethics Committees, my colleague Fred, the Director of the CDC Uganda, distinguished colleagues, distinguished participants, ladies and gentlemen. Honorable Minister, the last was very difficult. Difficult because of COVID, which has precipitated a lot of pain and a lot of death. Death, even in our own midst. I'd like to report that one of the members of the preparatory committee, Dr. Harriet Nabdere, passed away 2 months ago. And perhaps with your permission of the chair, allow us to observe 1 moment of silence in remembrance of her. Thank you very much. In this crisis, there have been many things in short supply. Integrity has been a very rare commodity. And in crisis, we've had problems with integrity. It has been elusive and it has been complicated. All of us have been helpless because we really don't know everything about this new pandemic. Now, out of this quagmire, we need and most importantly, we need integrity. We need research. Research is what is going to help us in solving this problem. Yes, research has a potential benefit, but research has also got risks. These risks must be minimized if they are to be helpful. They must be handled with transparency, and they must be handled with that rare commodity I alluded to earlier, namely integrity. Because in crisis, integrity can be elusive and it can be in short supply all the time. It explains why that the committee decided that this theme, the theme for this conference, fostering research integrity and promoting responsible research in Uganda and the region, is an attempt to address this very vital aspect of research. Very important in addressing the national ethical standards and processes involving human as research participants. An enabling environment, Honorable Minister, is required to ensure that the least harm is done to the subjects. Researchers too need to be protected. They need protection. Therefore, a conducive climate of integrity, climate of respect, and climate of honesty and responsibility should support that goal. Human participants involved in research are entitled to respect. They're entitled also to personal autonomy. Respect starts with informed consent. It starts with assurance of minimum risk, and it starts with individual confidentiality. The COVID-19 pandemic comes with unprecedented challenges to our ethical standards. These challenges are very broad. It's not just science. They may be social. They may be economic. They may even be spiritual. Foremost, we must overcome the technical and ethical challenges and ensure that there is credibility and validity in our research. The ethical challenges need without, without remorse in social media, on the social media. The community must provide oversight through engagement to monitor the risks and the protection of individual human rights within the context of health research. More responsibility is needed in those with compromised autonomy, such as children, such as prisoners. These groups need additional protection. Pregnant mothers, for instance, are vulnerable groups that need special care and special respect. Integrity is likely to be least in participants with special needs and the very poor. Therefore, the consent process among the vulnerable groups must be well managed, in order that it does not undermine or compromise the validity of what research findings that come out. The digital and satellite technology too has impacts. It has impacts on confidentiality. It has impacts on self-esteem, as individual information can be shared openly through mass media and social media networks. The One Health approach, which we have adopted as a national approach, integrates human health and also animal health. Animals too have, have been partners in these projects. Therefore, additional ethical guidelines are needed to safeguard the basic standards for animal rights in line with international standards. Well, dear participants, this conference provides a special forum for sharing not just challenges, but also sharing opportunities. And these challenges, with the many stakeholders. Today here we have many stakeholders. We have research regulators, we have institutional research ethical committees, we have policymakers, civil society, and the community to discuss very important issues and build consensus to enhance personal autonomy and the greater public good. How then can we try to show respect to research participants against these odds? First, the national research regulators have issued jointly prepared national guidelines of 2014 for research involving human participants in research. Last year, we also prepared national special guidelines for the research during the COVID pandemic. I'm appealing to all of you researchers and everybody, appealing to all of you members of the research ethics committees to maintain and sustain these standards. Second, we need continuing professional development. Professional development through training, through mentorship in new tools, new technologies, and new expertise. To implement this, we need skills development in protocol writing in particular, so as to access the grants to mobilize resources to support research expansion and also collaboration and partnership with other members of the global world. Thirdly, we must assemble and evaluate the research findings and generate innovations. Innovations, that's the new normal. That is the new normal and the new direction. Some researchers have seriously embraced this mission and are already ahead of us. Here, I would like to thank Professor Patrick Ogwang for the COVIDX molecule against COVID. Earlier, his team discovered a new local product based on artemisia tea that is very effective in the prevention of malaria. It is called Atavol. It's there in the shops. Clinical trials on efficacy and safety have shown that the product reduced malaria incidence by 60.4%. 60.4% among a community of 2,000 farm workers around Entebbe. The potential for prevention of malaria in schools and similar communities, therefore, are enormous using this new technology, new product. The product was successfully patented with the African Region Intellectual Property Organization, and now is being commercialized and available in pharmacies, and you can access it as and when you need it. We are already working with WHO and other partners to create innovation clusters in health for improved health delivery. The new Minister of Science and Technology has been very supportive, and I would like to thank you and thank you very much. In particular, we have double thank her by giving her a big clap on the new initiative on PRESIDE. PRESIDE is the presidential scientific initiative on diseases and epidemics. We thank His Excellency the President for the Presidential Scientific Initiative on Epidemics, PRESIDE. Funding from that initiative has already procured equipment for our center in Wandegea and supported ongoing clinical trials in traditional medicine and COVID-19. That capacity will continue and is available to all of us researchers when and if you need it. I thank the organizers. I thank Martin and also Gertrude, the chairman of the preparatory committee, and your nice assistants, Irene and Winnie. I don't forget your smiles when even times are very hard. I would like to thank all of them, and I think I'll just give them a small clap. They have done a fantastic job to make arrangements for this conference under this new difficult normal. We thank you, our guest of honor, for the special privilege for accepting to participate in this conference. I thank you.
Thank you very much, Dr. Okware, for the welcome remarks. And it's now my pleasure to invite the Acting Executive Secretary, Uganda National Council for Science and Technology, Dr. Martin Ongol, to give his brief welcome remarks. You are welcome, Doctor.
Honorable Minister of Science, Technology, and Innovation, dignitaries from government organs, the Board Chair, Uganda National Council for Science and Technology, the Director General, Uganda National Health Research Organization, the Secretary to the Authority, National Drug Authority, representatives from development partner institutions, the head of academic institutions, Director CDC Uganda, distinguished researchers and science stakeholders, ladies and gentlemen in your respective capacities, I would like to say good morning, and I wish to welcome all of you to the 11th Annual National Research Ethics Conference, the first of its kind in the new normal occasioned by the COVID-19 pandemic. Impact of COVID-19 pandemic on health and economies and livelihoods at national and global levels is unprecedented. It has no doubt transformed the way research and business is conducted At national level, it has created a lot of demand for scientific and research outputs, human resources, and infrastructure. These and other pre-existing challenges constitute the context for research involving humans and animals today, as we seek to provide lasting solutions to societal problems. The implications of these emerging challenges at national and global levels are that research must be responsive to patent issues, should be conducted promptly in order to generate timely solutions, will more than ever before require participation of humans and animals as subjects, incorporates standard operating procedures, SOPs, for prevention of spread of COVID-19 in protocols, and then outputs, especially vaccines, treatments, etc., are highly demanded, and yet there are regulatory and intellectual property considerations involved. The ANREC has over the last years evolved into a robust platform for training, networking, and addressing pertinent issues regarding the ethical conduct of research in Uganda and at global levels. This conference has been pivotal in training, establishing regulatory infrastructure, and guiding research policy and practice in Uganda. In doing so, ANREC ultimately contributes to research outputs that benefit society, the quality of Uganda's human resources, creation of employment, infrastructural capacity building, and it also earns foreign exchange for the country. The theme for the 11th ANREC is fostering research integrity and responsible conduct of research in Uganda and the region. It's a virtual conference. Further considerable progress has been made in terms of policy reforms and establishment of regulatory mechanisms both at institutional and national levels in ensuring safety of research participants, both humans and animals. The conference will address issues of quality of protocols submitted to regulatory bodies, efficiency in research protocol review, and building capacity and regulatory support mechanisms such as guidelines, forex, amongst others. Participants will further discuss ethical dilemmas arising in the conduct of research in Uganda, selective data reporting, reproducibility of scientific findings, amongst others. The conference will also seek to contribute to fostering confidence and trust in research findings. We will at this ANREC also officially launch the two guidelines that have already been mentioned, the National Research Biobanking Guidelines, and would like to thank the CDC for supporting the development of this guideline. And we also have the National Guidelines for Use of Animals in Research and Teaching. And this is very much of importance, especially to our colleagues in the National Agricultural Research Organization, especially in the veterinary sector, but also for other studies, especially preliminary trial of human drugs and the like. The 11th ANREC will feature highly respected international and local speakers who will share experience and insights on a wide array of issues related to the theme. We envisage a very productive and inspirational engagement. We invite you to fully participate for the 3 days, starting the 14th, which is today, to 16th September. As we conclude, I wish to once again welcome all of you participants from around the world, and in a special way, Dr. Gorwi Gapalakrishna, our keynote speaker. We have guests from the East African Community, Africa region, Europe, and Uganda. I wish to thank the Minister for Science and Technology, Honorable Dr. Monica Musenero, and the Minister for Agriculture, Animal Industry, and Fisheries, Honorable Frank K. Tumwebazi, for kindly accepting to preside over the conference and launch the National Biobanking Guidelines and the National Guidelines for Use of Animals in Research and Teaching. our partners, Authority, Uganda National Health Research Organization, the Office of the President. I also thank all the institutions and individuals who have made time to participate in this conference as facilitators, presenters, resource persons, and the staff of UNCST for organizing this conference. I would like to thank the 11th ANREC Planning Committee under the leadership of Dr. Gertrude Chiwanuka from Bara University of Science and Technology for their dedication and innovativeness in making this virtual event a reality. Thank you all, and I wish you fruitful discussions.
Yes, thank you very much, Dr. Ongol, Honorable Minister of Science, Technology, and Innovations. Ladies and gentlemen, in this plenary session, we are privileged to have an international speaker all the way from the Netherlands. She is going to give us our very first keynote address in this virtual 11th ANREC, titled Research Integrity and Responsible Conduct of Research, a Dutch case study. Dr. Gauri Gopalakrishnan is from the Amsterdam University Medical Center. She is an epidemiologist with policy experience. Some of her notable contributions include her role in the control and containment of the SARS outbreak in Singapore in 2003. In her current role as lead researcher on the Dutch National Survey on Research Integrity, she works closely with the lead principal investigator, Professor Lex Boter, to design, implement, and analyze results of one of the world's largest surveys on research integrity. She was featured in the Dutch media this year on her SARS experience and later on the impact of speed science, open science, and research integrity during the COVID pandemic. Dr. Gauri is currently also chair of the Equity Coordinating Committee of the International Federation of Biosafety Associations, focused on improving equity, diversity, and inclusion of marginalized groups in biosafety and biosecurity as a profession. Ladies and gentlemen, let us welcome Dr. Gauri to make her presentation. Thank you very much.
Thank you so much, Chairperson. Thank you very much to the organizers for this kind invitation. I hope you are able to hear me clearly. That's always one of the difficulties of speaking virtually. You can't really see actually your audience in front of you. So please do let me know if you are unable to hear me or see my slides. I will be shortly sharing my screen with you, where I would like to take you through a very recent study conducted and concluded in the Netherlands on research integrity. And then I would like to share with you some international perspectives on research integrity. It's really wonderful to be here and to see some familiar names that I have seen in the research integrity community. And that is very heartening to know that the community is indeed small but growing. So on that note, I will attempt to share my screen and my slides. And during my presentation, I will close my video just to ensure that the audio transmission is at its best. So I hope you are able to see my slides. I will go to share screen at the moment. So going back here. So thank you so much once again for this kind invitation. The title of my talk today is Research Integrity and Responsible Conduct of Research. I would like to showcase a very recent study in the Netherlands. And then I would like to put those findings into the international research integrity context, which I hope you will find useful and be able to take forward in your research institutions, but also be able to provide for an engaging discussion. The aims of the National Survey on Research Integrity, which is funded by the Dutch government and is currently one of the world's largest but also most comprehensive research integrity surveys to date, were twofold. The first goal was to estimate the prevalence of 3 different types of research behaviors: questionable research practices, research misconduct, namely falsification and fabrication of data, and responsible research practices. We were also keen to be able to determine what we call explanatory factors, or the determinants of these different types of behaviors. And we chose 75 different explanatory variables to be able to do this. The Dutch survey was an online survey, as I mentioned, covering 4 different areas. We had 11 questions on questionable research practices, 11 questions on responsible research practices, and 2 questions on research misconduct, namely falsification and fabrication. And as I mentioned, 75 different items on determinants or explanatory factors, in order to be able to understand what were some of the factors driving these different types of research behaviors. On the explanatory factors, we covered 12 psychometric scales known in the research integrity literature to play a role in research misbehavior. And these are what you see listed here on this slide: work pressure, publication pressure, funding pressure, mentoring, competitiveness, science norms, peer norms, organizational justice, and the likelihood of detection of research misbehaviors by collaborators or reviewers. I want to pause briefly on this slide to take a moment to explain the scientific norm subscription, because this is an explanatory factor which turned out to be a key finding in our survey results, which I will walk you through later in some of my slides. Now, this particular scale builds on the 4 norms of good science that was initially proposed in 1942 by Robert Merton, also known as kudos: communalism, universalism, disinterestedness, and organized skepticism. They refer to the norms or scientific ethos that scientists should subscribe to, such as whether they should be motivated by knowledge or personal gains in their scientific work, whether they should consider all new evidence, including those that are contradictory to their work, whether they judge each other's work solely on the quality of their contributions, and so on. And this particular norm was a key finding in our survey, and therefore I wanted to take a few minutes to explain what it means. In the interest of time, I will move on very quickly to the main results of the national survey. What we found was among 7,000 respondents with a response rate of about 21%, which overall might seem low, but is really in the target area of national surveys on research integrity. What you see in this slide are the top 5 most prevalent questionable research practices from our 11 questions on questionable research practices. And the range here is roughly between 15 to about 20% for frequently committing these specific QRPs. So you see that the top questionable research practice that respondents had admitted to frequently committing starts with not submitting or resubmitting valid negative studies for publication, an insufficient inclusion of study flaws and limitations, followed by insufficient supervision or mentoring, insufficient attention to proper equipment, skills, or expertise, and finally, inadequate note-taking of the research process. So these were the top 5 questionable research practices. On this next slide here, you see the prevalence of any frequent QRP. So in essence, what this means is that more than 50%, so slightly more than 50%, about 51%, or 1 in 2 researchers in our group of respondents of 7,000 admitted to committing at least 1 or more of the 11 QRPs in our survey frequently. What was a little bit more concerning was that 8%, or 1 in 12 researchers, admitted to having fabricated or falsified their research in the last 3 years. Now, these figures are concerningly high. They are also consistent with a recent systematic review looking at all research integrity surveys. Now I want to go on to present to you the regression analysis that we had conducted on the questionable research practices and research misbehaviors as an outcome against the 12 explanatory variables in order to be able to assess what associations or influencing factors were at play that might be associated with these misbehaviors. By understanding the factors, we can better understand the drivers behind these types of behaviors, and thereby our goal was to propose then sustainable solutions to research institutions in order to be able to counter them. In this slide, you see the most significant results of the regression analysis. It's quite a busy slide, so I would like to slowly walk you through this slide. In bold, what you see are the explanatory factors that have significant associations against the outcome, which is a questionable research practice, a mean or any frequent committing of questionable research practice, or research misconduct, which is defined as any FF, so any falsification or fabrication. Now, I'd like to draw your attention actually to three particular explanatory variables, and these three are publication pressure, scientific norm subscription, and the likelihood of detection by reviewers. What you see in red is the explanatory factor associated with a higher QRP mean or odds, in other words, being detrimental for research integrity. In green, we saw significant association of explanatory factors associated with lowering the mean or the odds of questionable research practices. In other words, promoting research integrity. So what we see is that publication pressure had the biggest significant increase in questionable research practices. Scientific norm subscription and the likelihood of detection by peer reviewers brought about the largest decrease in questionable research practices and research misconduct. Now, that was the slightly non-heartening news that we found in our survey, but our survey also asked on how prevalent responsible research practices were. And this is something that we covered for the first time in a research integrity study. And before I continue, I just want to take a few seconds to actually explain very quickly what open science, how we had defined open science, to ensure we are all on the same page before I proceed further. Open science can essentially be broadly classified into these 5 different blocks. Our specific goal was to assess a number of these blocks. In particular, I like to bring your attention to 3 main aspects of open science. Open access publications, basically as being able to access journal publications without a fee. And that also includes preprint publication, and these are non-journal, non-peer-reviewed papers that are shared on open platforms, such as the Open Science platforms or one of the archive platforms. Open sharing of data, and pre-registration of study protocols or the sharing of open methods. There are also other aspects to open science, such as open educational resources, open peer review, and open sharing of codes and syntaxes. This figure, in essence, summarizes what we mean by open science. Now, in this slide, what you see are 4 of the 11 responsible research practices that we covered in the Dutch National Survey on Research Integrity. And what you see is that the range of open science practices is going from roughly about 42% to about 75%, which is quite heartening. However, disclosure of sharing of data and pre-registration of study protocols, unfortunately, was quite low, lower than what we had expected. And this attests to the fact that while open science is a movement that we are increasingly seeing in our research communities, there is still quite a bit of work for us to do, particularly with disclosure and sharing of data, and with regards to the open disclosure and pre-registration of study protocols early on in the research process. Now, similar to the regression analysis that we had conducted on questionable research practices and research misbehaviors, we were also interested in determining if any of the 12 explanatory factors were significantly associated with responsible research practices. So, what are the positive drivers of responsible research practices? In this slide, again, you see here the most significant findings. In red are explanatory factors with a significant decrease in responsible research practices mean. In green, you see the explanatory factors which led to an increase of the responsible research practices mean. So what we really see, I'd like to summarize here, is that publication pressure is coming back in our analysis, and a single explanatory factor associated with the overall responsible research practice mean. And if you recall earlier finding on questionable research practices, again, we saw that publication pressure led to an increase in questionable research practices, the odds of questionable research practices. Mentoring had the largest significant association with increasing the odds of responsible research practices. So in conclusion, I'd like to actually draw your attention to three main key findings of the national survey. In summary, what we showed is that questionable research practices is unfortunately much more prevalent than we had anticipated. One in two researchers had admitted to frequently engaging in at least one questionable research practice. Research misbehavior was also much higher than previously reported. Previous reports had attested to for our survey had put that down to about 8%. So what are the areas we should be focusing on in the responsible conduct of research? Scientific norm subscription, as I explained in one of the slides, mentoring, peer review or scholarly review in all forms, not just in journal peer review environments, are positive and support the development of responsible conduct of research. Publication pressure turned out to be a key finding that hindered research integrity by lowering responsible research practices and increasing the odds of questionable research practices. So that, in essence, really summarizes a 3-year study that was funded by the Dutch government, which we have concluded. Our preprints are available and can be found on our study web. At one of my earlier slides, you can find the link where you can download the 2 publications and read the details of these studies. Now, what I want to do actually today for our audience here is to try to bring in some context with regards to international efforts on research integrity. Here on this slide, you see several examples of discussions and initiatives that have been put in place in the recent years. There are at the moment several codes of conduct on scientific integrity, such as the European Code of Conduct. Pictured here is one example and accessible online. There's also the Netherlands Code of Conduct. So the European Code of Conduct has really spearheaded the setup of several different European country-specific codes of conduct. I also want to point out the San Francisco Declaration on Research Assessment, or the DORA initiative, which is another initiative with regards to changing the way we assess research. The Hong Kong Principles, more recently developed at the last World Conferences on Research Integrity in 2019, also outlines what research institutions can do to change the way we assess science and promote research integrity, moving away from only metrics and quantity and towards the quality of scientific publications. So a few words on the DORA Declaration. This was written by a group of editors and publishers of scholarly journals in 2012 during an annual meeting of the American Society for Cell Biology. They developed a set of recommendations that is chiefly focused on the need to eliminate the use of journal-based metrics and the need to assess research on its own merits rather than on the basis of where it is published. So this is a very important and interesting movement in the research integrity community. I also want to say a few words on the Hong Kong Principles that was developed at the World Conferences in 2019. In summary, the Hong Kong principle really states that we should reward responsible research practices and avoid perverse incentives when assessing researchers, and not merely rely on bibliometrical indicators, such as publication and citation counts, and their derivatives, such as impact factors. So again, we see that the Hong Kong principles in many ways echoes the San Francisco statement on the Declaration of Research Assessment in 2012. So moving away from quantity towards quality as a way of assessing contribution to research. This slide summarizes actually the essence of the 5 Hong Kong principles. So in a nutshell, the 5 areas of focus that attendees at the Hong Kong principle have decided to sign on to are firstly to assess responsible research practices, open science being one of them, to value complete reporting of research. So in other words, from the start of the research protocol all the way up to publication, and not only at the end stage of the research life cycle, to reward the practice of open science and open research, to acknowledge a broad range of research activities, reward researchers for engaging in such activities such as teaching and training, to recognize other essential tasks such as peer reviewing and mentoring. So really broadening the manner in which we assess our researchers and go beyond publications and metrics associated with that. You can download and freely access the full report on this citation. I also want to spend a few minutes actually talking to you about another important and recent development in the international research integrity community, and that is summarized in this Nature piece on how specifically research institutions and funders should help their researchers maintain research integrity. This is also an open access publication which can be freely accessed. What you see here is a summary table of the recommendations coming out from this recent Nature publication. And the table summarizes 3 broad areas for funders and research institutions to focus on. So broadly, they have categorized their recommendations into support, organization, and communication. Under support, this is essentially about promoting training and education on research integrity, but also including mentoring and focusing on the research culture. Under organization, we see that this is really focused on setting up an ethics structure for all types of disciplines across the board and all different types of studies, not only focusing on the biomedical studies. Organization is also about having procedures in place from research institutions to protect whistleblowers. It also makes an emphasis on data management and having data management champions, for instance, as a way to promote and assist in the FAIR data principles. The FAIR principles referring to making one's data findable, accessible, interoperable, and reusable. Finally, under communication, this is about conflicts of interest and responsible science communication with different stakeholders. So as we move towards promoting and rewarding open science as a responsible way of conducting our research, researchers also increasingly need to know how to engage with a broader group of audience that may be non-scientific, such as policy advisors and the general public. So bringing all of this together in the context of Uganda or low and middle income countries, what really are the challenges for research integrity and open science? I see on your program that you will discuss this more in depth over the next couple of days. What I'd like to bring to your attention, and which I hope will lead to some interesting interactions in the next few days, are 3 main areas so far in my experience, and also discussions with other colleagues that require focus in low and middle income countries. One is the building of infrastructure, particularly for open data sharing and for fair data management. Second is a focus on training and education and responsible conduct of research. And thirdly, a need for national and regional guidelines and codes of conduct for scientific integrity. Finally, I'd like to end my talk with a cordial invitation to all of you to discuss these issues and more at the next World Conference on Research Integrity. It will be held in Cape Town, South Africa in June 2022. There will be a focus on low and middle income countries and research integrity, and I hope to be able to see many of you there once again. Thank you so much for this kind invitation, and I'll stop sharing my slides at this moment. I'm happy to take any questions that you may have.
Thank you very much, Dr. Gori. Let's just give her an applause. Yes, at this juncture, I know we are really running behind time, and usually we do not really discuss keynote address. So allow me to quickly move on to our next session. Ladies and gentlemen, you are aware that this is going to be a very special UNREC in the sense that we are going to have the launch of the National Research Biobanking Guidelines. And together with us, we have the Honorable Minister of Science, Technology, and Innovation, who will be doing the launching. But before she comes on, there are some key individuals who have been behind the developing of these guidelines. And we are going to have 3 of them speak to us before the minister comes to do the launching. And I would like to invite Dr. Fred Nakwagala, who is the chairperson of the Forum for the Chairpersons of Research Ethics Committees in Uganda. And he has also been the chairperson of the task force that has developed these guidelines. And for these 3 individuals who are coming to speak with us, in the interest of time, because we really want to have our beloved service providers cover the minister as she does the launching. So I'm going to be very frugal with time. I'll give you only 5 minutes each. So Dr. Nakwagala, please give us an overview of the guidelines that are going to be launched today. Thank you.
Honorable Minister of Science, Technology and Innovation, and colleagues in the regulatory field of Uganda, I'd like to welcome you to this very interesting moment when we are going to launch the National Research Biobanking Guidelines. On the 18th of July 2011, an interesting discovery was made on Mount Napak in Karamoja, where a 20-million-year-old, the fossils of a 20-million-year-old ape were discovered in the volcanic ash of that area. It was transported to France, reconstructed and returned the following year, and lies in our National Museum. This is one of the oldest biological specimens in the world, particularly the oldest that I know of. And we are proud to be the Pearl of Africa in that sense. For we know that life began in the East African Rift Valley region. So the biological specimens are an essential element for fostering research worldwide. They inform our history, our present, and our future. They have enormous value that many people are not aware of. And right now, they propel in many areas more than 3/4 of research involving humans. Uganda is one of the first African nations, if not the first, to create guidelines for the acquisition, storage, and use of biological specimens in research and for other purposes beyond research. To underscore the importance of the formulation of guidelines so as to enable the propagation of research in this country, the Uganda National Council for Science and Technology teamed up with other partners, including the CDC and partners from all fields where life sciences are involved, particularly in agriculture, in forestry, in animal husbandry, and environmental sciences, and human health services. They came together, and for a period of 2 years, we had a multidisciplinary team of experts coming in from the research collaborations, from Ministry of Health, from universities, and from the affected sectors that I've mentioned, to develop the guidelines that are going to guide us on how we do the business of biobanking in this country. These guidelines that are going to be launched, in their scope, they will cover the areas of research and technology in the fields of health, agriculture, horticulture, animal health, forensics. We have a very wonderful forensic service in Naguru. Environmental sciences, aquatic sciences, wildlife, and education. In their provisions, these guidelines will speak into the establishment of biobanks. They'll provide guidance on the governance, how these biobanks are going to be governed, the oversight from the Uganda National Council for Science and Technology, and the collaborative arrangements with the different partners within the multi-sectoral approach. The guidelines will also provide management platforms on how biobanks will be operated on a day-to-day basis, providing for the leadership structures right within each individual biobank. They'll provide for access issues. As you understand, biobanks have a lot to do with national security. Right now, Uganda has the biggest collection of COVID lungs on the African continent. Because of the direct relationship between biosecurity and biospecimens, these guidelines provide for the biosafety arrangements, and therefore for how these biobanks are going to be accredited, and they emphasize the issues of ethical standards and research integrity that we've just elaborated. With that introduction, I would like to thank the team that we worked with over the 2 years, and also to thank the CDC that facilitated these processes, the UNCST and other partners that came together to create this lovely product. Thank you very much.
Yes, thank you very much, Dr. Nakwagana. May I please now invite the Country Director, CDC, to come and talk to us. You are welcome, Lisa.
Good morning, colleagues. Honorable Minister from the Ministry of Science, Technology, and Innovation, the Board Chair and the Executive Secretary of UNCST, the Representative National Drug Authority, and the Director General of Uganda National Health Research Organization. All colleagues and all protocol observed, and it's great to see many of you here this morning. And so I'm Dr. Lisa Nelson from CDC Uganda, and we're an organization that appreciates organized skepticism. So I appreciated the remarks from this morning. I'm really delighted to be here this morning to provide a few remarks at the launch of the 11th ANREC conference, as well as the launch of the National Research Biobanking Guidelines, which you've just heard about. I want to commend UNCST for not only providing stewardship, but also providing a platform for researchers to engage. Sustaining this conference for the 11th year in a row is a very large accomplishment, so congratulations. I've been here in Uganda for 4 years, and I must say I'm absolutely impressed each and every day about how much groundbreaking research is done here in Uganda with such high quality, and how many Ugandan researchers are really making their mark around the world. It's just great, and it's great to see that the theme this year of integrity in research is very important and very timely. So the U.S. Centers for Disease Control and Prevention, or CDC, is a U.S. government public health agency with a global reach. We have staff in over 70 countries, including here in Uganda. And we conduct and support unparalleled life-saving science and groundbreaking public health research to ensure that people worldwide live healthier, more stable, and more productive lives. I think lab, surveillance, these things are near and dear to our heart, but it's also about taking public health research into programs to achieve public health impact. In Uganda, we've supported activities since at least 1991, when we started the Public Health Without Walls Fellowship Program at Makerere University. And with the launch of the President's Emergency Plan for AIDS Relief, or PEPFAR, in 2003, Uganda became a focus for that program, but also was able to support public health research in HIV and TB, as well as scale up of programs that have saved more than 18 million lives around the world. CDC is and remains committed to ensuring that public health research is done with integrity as a core value, both for staff, for partners, as well as for beneficiaries of this research. We aim to protect the rights and welfare of Ugandans who participate in research, review CDC-sponsored data for ethical clearance, and foster privacy and confidentiality for proper use and disclosure of protected health information through our Associate Director for Science in our office. We have many collaborations with many of you in the room, as well as with many parts of CDC at headquarters on research in areas such as plague, Ebola, COVID-19, and many others. Just to give a few examples of ongoing studies, the Uganda Population-Based HIV Impact Assessment has completed fieldwork, and we expect preliminary results soon. We will also be launching a refugee component, or refugee EUFIA survey, hopefully before the end of the year. And we have a nearly completed yellow fever fractional dose study, the only one of its kind in the world that will look at whether a smaller dose of yellow fever vaccine is equally efficacious in children. So I think we're delighted again about this conference and its importance. Equally important is the launch of the National Research Biobanking Guidelines. Biobanks, where we store biological material, have become vital to the fields of human and veterinary medicine, agriculture, and many other aspects of research. Not only do they provide historical data for research into what has happened, but also for the future, what can happen and trends over time. They contribute to our knowledge as well as livelihood, continuing new frontiers, advances in technology, innovations, and really will promote effective and affordable services for people. They do represent a gold mine of opportunities for students, researchers, and policymakers. And we all play a critical role in this process, from donating biological specimens to obtaining authorization for their processing, for storage, etc. But much as these are an important resource, biobanking comes with operational challenges due to ethical, legal, and social implications surrounding utilization of patient samples and data. Some of these controversies include consent to use stored specimens, privacy, confidentiality, data ownership, and specimen storage. Therefore, it is with great hope that these new guidelines will lead to ethical and appropriate utilization of the biobanks here in Uganda, as well as promote further investment in research. I understand from my team that the development of these guidelines took a consultative process with various stakeholders involved in the biobanking regulatory landscape, both in country, as well as relying on international expertise. CDC is therefore proud to have supported some of the initial stakeholders meetings for these guidelines as early as 2018, as part of the support to operationalize the biorepository services at the National Health Laboratory Services, or UNHLDS, which is one of the largest biobanks here in Uganda. For the health sector in Uganda, these guidelines have come at a vital time. There is great scale-up in laboratory science, such as routine public health genomic sequencing for COVID-19, using remnant samples, and routine HIV drug resistance testing in lieu of sentinel surveillance approaches. So in closing, we appreciate the Uganda National Council for Science and Technology for all the partners who are here as part of the 11th ANREC conference, and for the launch of these guidelines. And we thank all of the stakeholders here for their technical support that has ensured completion of these guidelines. As others have talked about, the technical and political leadership here on science and research in Uganda is really unprecedented. And I want to thank all of you for your exceptional work. We as CDC and as the US government are honored to be part of the development of these guidelines, to participate in the opening of this conference. We look forward to our future partnership. Thank you very much.
Yes, thank you very much, Dr. Lisa, from CDC Country Director. And at this juncture, I'd like to invite the chairperson, the board chairperson, Uganda National Council for Science and Technology, Mr. Byarugaba Bazirake, to come and invite the Honorable Minister of Science, Technology and Innovation to officially open the 11th ANREC.
The Chief Guest, Minister of Science, Technology and Innovation, Dr. Musenero, distinguished guests in situ and online, all protocol observed in interest of time. For us, and at Uganda National Council for Science and Technology, it is a great pleasure to have this opportunity to be here. This is a scientific occasion, but before I proceed, Honorable Minister and colleagues, I believe science without God is not science, not successful. I wish to call upon all of us to clap for God in the loudest. Afford. Why? We thank God that we are all here. I, for one, I have lost colleagues, professors, doctors. We can't mention and finish. Who are we? We are scientists, but there is that great God that keeps us alive. I can't proceed without acknowledging that our being here is a special privilege in Uganda National Council for Science and Technology. Having said that, allow me to verbatimly read the speech of the substantive chair, Dr. Teresa Sengova, who sent her greetings and is not able to be here with us today. I wish on behalf of the UNST to welcome all of you to this 11th ANREC. I especially want to thank Dr. Goweri Gopala Krishna, who presented wonderfully online. She has broadened the knowledge on the principles of research integrity. I'm particularly heartened that over 800 researchers, regulators, policymakers, members of the Research Ethics Committee, civil society, and research communities have joined this forum to share with us the ideas and forge a way forward. UNST is usually responsible for formulating ethical guidelines, accrediting research ethics. It has ethics committees, and ensuring ethical conduct of research in the country. Anybody who does research without going through a UNST is a defaulter. UNST, therefore, has had an annual increase of registered research by 10.3%. It is therefore imperative to have the principles and values that promote a responsible conduct of research that are clearly defined and promoted. UNST considers research integrity as a prerequisite for a successful academic research environment and promotion of science, technology, and innovation in the country and in the world. This conference, therefore, is timely and will guide us to combat disease and improve livelihood of Ugandans and the world at large. I sincerely thank all the partners, the National Drug Authority, the Uganda National Health Research Organization, as well as the government of Uganda for the support and for this great initiative that is taking place today. I also wish to thank all of you online and present here who have managed to make it to come and attend. In interest of time, allow me to thank particularly Dr. Gertrude Chiwanuka from Barada University.
Science and Technology.
A big clap for her. This lady has worked from Barada University of Science and Technology, and several other team members who made this a success. Before I conclude, again allow me, on my own behalf, to ask everybody to clap for the special minister we got who was a presidential support advisor, presidential advisor on epidemics, and is now the Minister of Science, Technology, and Innovation. A big clap for her. Honorable Minister, we are honored to have you here. As a scientist, as an addendum, it can be taken to a further. Being in the country, I'm a scientist who have also been widely traveled. I've been in 60 countries of the world because of scientific research. 60 countries of the world. I have that there is a need for more resources to support research. Honorable Minister, this cry for so long, but you are here, this will be handled. At 1% even of the GDP, we have always cried. We know countries like Sweden have 4%. Ethics committees, the ethics is very, very important. I come from a university background. Many people are doing research without having ethics committee approval. This is the default. My request is that these committees are made wider. Last but not least, bioethics. We are talking of general ethics, but when we are talking of human beings and animals, let's consider more bioethics in our integrity. I wish to say that these bioethics should be at a wider level, visibly through the biobanking, especially in the COVID-19 pandemic. I thank you all for listening to me. Thank you. Yes, at this juncture, it's my pleasure to invite the Honorable Minister of Science and Technology to come and address the audience. Thank you, Honorable Minister.
um, all dignitaries from the government organs, the board chair, Uganda National Council of Science and Technology, Executive Secretary, Uganda National Council of Science and Technology, the Director General, UNRO, Secretary to the Authority, National Drug Authority, as represented, representatives of all our development partners, and the National Director of CDC, the heads of academic institutions present physically and online, distinguished researchers and science stakeholders, ladies and gentlemen, in your respective capacities. I'm going to give my remarks in hybrid. I have a speech prepared for me, but I also want to use all these occasions to speak my vision for science, technology, and innovation in the country. So I'm going to give a hybrid in my remarks. I want to thank the organizers for inviting me to officiate at this meeting of the 11th Annual National Research Ethics Conference, NREC. I want to congratulate you upon organizing the conference today, despite the challenges of COVID-19 and the impact that it is causing around the world. But on the other side, I also want to celebrate us for being very adaptive. And some of these ways of doing business are better than the previous ones. You can imagine footprint would have if everybody had to fly here. But now we are able to do this in an environmentally safe manner. So I congratulate us for adapting to the new normal. I also extend a warm welcome to and everyone for part in this conference in a special way. And I want to thank our keynote speaker, Dr. Gauri, from the University of Amsterdam, Netherlands, for a special presentation in which she has shared with us her experience and some reflections of the COVID-19 pandemic and its impact on research integrity. And it is really good for us to learn from this example of the Netherlands and to see what is happening all over the world. I personally like or prefer, and I hope will more increasingly use research integrity than research ethics, because I consider integrity than ethics. It is more descriptive of what we want than just the ethical part of it. Because while ethics is relative sometimes, integrity cannot be questioned and compromised. You are either whole, integral, or you're compromised, corrupted. At this point, the theme for this year's conference is fostering research integrity and responsible conduct of research in Uganda and the region. This theme is very, very, very important for us, since we are witnessing a transformation of the global research innovation enterprise. And the development of the research and development expenditure and innovation activities in Uganda not being an exception. And I would like to state that Uganda, especially, we are categorizing ourselves as before COVID and after COVID. So at this moment, we are really at the launch pad of the next phase of research in the country. We have had several phases. These are arbitrary, these are made by Monica, so don't refer. The first phase was the pre-colonial Africa. I've been gratified to find out how much research and innovation was going on in our indigenous communities. They were finding things in their environment and improving them and putting them to the solving their problems. I don't know whether you ever question yourself how our ancestors found out which plant was medicinal, which one was treating what. But more formally, they actually had research. They actually developed innovations. They actually solved their problems. That was the indigenous Africa research, which was projected to grow like everywhere else in the world. However, as you know, we had an interruption and we went to phase 2. Unfortunately, phase 2 was a step wrong direction. We became users of research made elsewhere. And the Africans themselves were really users or participants and not decision makers. And we were just using, learn how to use chloroquine, give up using the herbs that you knew or your grandmother were, stop finding out and adopt this phase. And that phase carried us up to, in Uganda, up to maybe in the 1990s. Then we started the phase 3, where we had researchers returning from wherever they had been, and we started building national capacity for research. And here participants went into research, largely contributing to basic research or information and knowledge generation, but never productive research. That is why if you now go to our shops everywhere, you hardly find anything made in Uganda. Yet there is a lot of research going on. In all institutions, but this research is not productive. Now, we have launched phase 4. We are now not just focusing on generation of knowledge. We want to finish the value chain. Every researcher does has a product at the end. And that product has commercial value, it has social value, it has something, and hardly have we benefited as Africans from this research. So this phase is going to require a different package of integrity. That's where I'm going with all this. We are going to need a different package of integrity because we are going to a phase of made in Uganda. Made in Uganda. So as we talk about research integrity, I want to thank the team which has been working. I just want to point out in a minute or two the areas that we might have to think through. One, research integrity involves the whole spectrum of the stakeholders, starting with the donors, moving to the research institution, moving to the government, the research institutions, moving to the researchers, and the users too. For the donors, our prayer and request is that now we are going to adjust. We are requesting that we adjust to support this drive for Uganda to have intellectual property and products from research conducted. And that is going to require that we review some of the agreements that we sign, the donor agreements that we sign, that make us secede every intellectual property, either without knowledge, because we have not opened our eyes, but also we have not, or we sign it away. And I will be visiting all the donors and holding discussions. We really appreciate the donors, but we want you to support us to transform from being just consumers of such products to also being producers of research products. So the intellectual property rights, and I'm so happy about the biobanking, because a lot of material, a lot of diseases that we have had since 1936, we have had Uganda Virus Institute, and we hardly have any viable biobank that keeps this history and can help us to go back and harness this. We also have the government, which is responsible for setting the policies, the Ministry of Science, and all the policymakers. We are going to be realigning our expectations out of research, and that is going to define and demand a different level of integrity. The research organizations should take role. Recently, I had an experience where we couldn't really define who is responsible for playing this particular role. In the reorganization of science, technology, and innovation in the country, we are going to strengthen the research integrity role of National Council and Science and Technology. It has to be visible because that speaks on made in Uganda. Is it quality? Is it ethical? Was it produced with integrity? So we are going to close all those gaps. Much as we have published, I've seen we are publishing, we are working on them. We are going to review some of these things to make sure that we are watertight. And stations. I also wanted to mention in brief research integrity. It is a little bit too concentrated on health and maybe a few biological things. Right now, we are driving 6 value chains, because it's not only to solve public health or to solve a few questions. Research drives the economy. Research drives the economy. So I really want my researchers all over to know that research is not just something you do humbly in the lab. We are the ones going to determine is going to sell on the market in the coming years. So we have the pathogen economy, where we have health, medicines, anything to do with health of medicine, of humans, of animals, then we have the digital. We are launching out on the digital in a very purposeful manner, and it has ethics. Otherwise, we will have people producing viruses and all these things. Then we have our beauty and apparel. Our people are using a lot of toxic products, especially in the locally made. Somebody will say, oh, use this to remove, but they have put mercury in it. And you don't see the ethics of it. Then we have the mobility, the motor vehicles and all that. We have made a very long, by the end of this year, we'll be launching our motor vehicle, the first indigenous motor vehicle manufacturing facility. And but we'll have finished, we'll launch it early next year, and we'll start rolling off vehicles made in Uganda. We have engineering. The engineering, you've seen, people put up things and they break tomorrow, they break the next day. We want to make sure that there is ethics in the research because it's not just bringing in what has been made elsewhere. We have brains in here being made by these materials, and by all the research you have made, you have really demonstrated the capacity of Ugandans to do this research. And then, of course, we have our main one, the agrosecurity. So I would like, many times when we go into, what's your time? Okay, I'll be done. So my expectation from the National Council is that it's going to expand and strengthen and refine the research integrity capacity in the country and build this capacity. Set up all those studies like the ones that we have seen in Netherlands. Put us on the cutting edge so that whatever comes out can be trusted. I will be discussing with the board soon the new framework that we have working through with the president. It's a high level of interest. It's no longer at this, you are there on your own. It's at the very, very top level of national interest. Then we expect the researchers, and we are going to have to reorganize our researchers. They have been used to a different way of doing research where you are just there, you can hide, you come for your research, they approve. And because of that, we have had some unpleasant situations, indeterminate situations. And this integrity should cover even things like, how do you announce that you have a product? And if you announce wrongly, there should be a penalty for that, because you cannot just do your research alone and begin announcing it before the committees, before the checks for integrity. How do you communicate with the public? Because we all know that research has percentages and probabilities, but for me, if I come up and say my thing does everything, I don't know if we have many drugs that will have 100% cure rate. We are always going by percentages, p-values, and what. So we must build the capacity of our researchers to do these things. We have focused, and we usually focus a lot on clinical trials, but there are other field trials that must be covered. Clinical trials use human beings, of course, because you're putting something. So we have that. How about the field trials? You know how we have been back and forth with our act, but the bill, it has been up and down because we don't have data. We don't have data. So the responsibility, we also need the responsibility of the researchers to complete research. There are so many people who receive research funding and they just not complete the research. And they may write a report, but they have not completed what they promised. So the responsibility of the researcher, what are you committing yourself to? So I would like to end my remarks by again saying that Uganda, for us to realize the vision of becoming our upper middle income by 2040, as envisaged by the set medium-term targets, by the 5-year national development plans, we need to have a very strong framework and evaluating research results to assist our scientists and researchers in their day-to-day practice. They need it to be very, very clear. They need it to be simple. They should be measurable, and we should be measuring them. So research integrity is the foundation of credible research, whether it's a vehicle, whether it's a bicycle, whether it is a satellite, whether. So lately, a lot of reasons of fraud and other unacceptable behavior in research have been highly publicized in scientific journals and mass media. I read one, sometimes we are confused. Actually, we are sometimes confused. Right now, there is a raging debate on ivermectin versus vaccination. One paper was published, then it was pulled down, a lot of reviews, and it is very, very confusing. So it is really, really important that we straighten this out, especially for some of us developing countries, which depend on those findings. So as you are all aware, research integrity is strongly associated with scientific misconduct in terms of plagiarism, data fabrication, and falsification. Therefore, a national approach to responsible conduct of research is inevitable. The National Council is in the process of finalizing the National Research Integrity and Code of Conduct Policy, which will provide guidance on the roles and responsibilities of researchers and how to manage research misconduct practices and the interface between research ethics and research research integrity. From today, building on recommendations that will be made on this conference, my ministry will work collaboratively with researchers and scientists to provide the necessary supportive framework for promoting research. More importantly, our ministry will take note of the recommendations from this conference to inform our policy decisions on how to promote research integrity and responsible conduct of research in the country. Finally, I wish to conclude by thanking the National Council of Science and Technology for organizing this conference, along with the National Drug Authority and Uganda National Health Research Organization. I also thank each one of you for your participation from around the world. It's now my pleasure to declare the 11th Annual National Research Ethics Conference officially open on this 14th day of September 2021 and wish you fruitful deliberations. And in the same vein, it's now my pleasure. Can I have the document? So it's my pleasure now to carry out the second.
Members, could you please come? If you are here, you can stand over there.
Excuse me. Do we have a do we have a do I there?
I think Honorable Minister, you should come and be there.
Do we have a microphone there? Maintain social distancing, please. You must first be safe. So, to all our participants all over and the viewers who are watching us, it's now my pleasure to launch the National Research Biobanking Guidelines for Uganda. So here we are. Biobanks are very, very important. And this is a very, very important step because now we can collect all our materials and use them for research for the future. Thank you.
Thank you very much, Honorable Minister. All right, thank you very much. We shall more But allow me to appreciate all the participants. I would like to begin by thanking the Honorable Minister, Dr. Monica Musenero, for taking off time of your busy schedule to come and officiate the opening of the 11th ANREC. I also would like to appreciate the country director, CDC, for being part of this opening ceremony. I do want to thank once again the members of the Advisory and Planning Committee of the 11th ANREC. I do acknowledge the contribution of our partners, NDA, UNRO, together with UNCST for hosting us. Thank you very much. Those of you who are online, we are happy that you have made it. And even as we are breaking off briefly for the health break, it's not that we are going away. We still have plenty to provide online. We are going to have some training video clips, so you can grab a cup of coffee or a cup of coffee or tea, and please stay online because we are continuing. We have another session, and that will be the last session for the day. So from my side, as the chairperson of the 11th ANREC Advisory and Planning Committee, I continue to wish you the very best as we continue in today's deliberations. Please stay tuned. And thank you very much, our service providers, NBS, for keeping us on air. Thank you so very much. So, yeah. So we're going to have a group photo for all of us who are in here. Please come to the platform. We'll try to observe some social distancing if it's possible. Could we first of all have the APC members with the minister? APC members with the minister.